Hello, I'm Seth Lederman, CEO of TNX Pharmaceuticals, and today I want to update you on TNX-801, our new single-dose vaccine to protect against smallpox and mpox. TNX is a public company, so this is our standard safe harbor statement that I will be making forward-looking statements. Smallpox was eradicated in the 1970s. Yet, there are big concerns about smallpox being reintroduced. After smallpox was eradicated, countries like the United States stopped their smallpox vaccination programs. We also stopped supporting vaccination in Africa, and those have had two consequences. One is that we've left the United States population very vulnerable to an attack using smallpox, bioweapons attacks. And the other is that stopping vaccination in Africa has allowed mpox to get back into the human population after it was kept out from smallpox vaccination. There have been two global epidemics of mpox in the past 2 years. Starting in 2022, the clade 2B epidemic started, and that spread rapidly across the world outside of Africa, mostly in gay men. Today, mpox 2B is endemic in certain gay communities in the United States. A second mpox epidemic started last year, and that's called clade 1B. And this one is different because it is transmitted by heterosexual sex and also is very contagious within families. So children are affected and sometimes get serious disease. Going back to the origins of smallpox vaccines, the first vaccine was created by Edward Jenner. And Edward Jenner described it in this book called The Inquiry over 200 years ago. And he found that cowpox was a disease that affected milkmaids, and he could take material from the sores on their hands and use it as a vaccine to protect against smallpox. Today, we have two FDA-approved vaccines for smallpox and mpox, and they're both derived from Edward Jenner's vaccine. ACAM2000 is a live virus vaccine. It's a single-dose vaccine, provides years or decades of protection, but it has tolerability concerns. A newer vaccine called Jynneos is a non-replicating version of Jenner's vaccine, so it's quite a bit weaker, and there are real concerns about the durability of its protection. So relative to the original Jenner vaccine, ACAM2000 appears to become more virulent, and MVA is much less virulent, but also requires 2 doses and has concerns about the durability of protection. We took Jenner's vaccine and tried to modernize it. Now, Jenner was not just a country doctor. He was a member of the 2 most prestigious scientific societies in England. And he had searched far and wide for an inoculum that would make a good smallpox vaccine. And he was successful, and he called the origin of the vaccine cowpox. But in his writing at the time, he said that he believed it had come from horses. So we took notice when the sequence of horsepox virus was published in 2006. And this was the sequence from an isolate from Mongolia in 1976. We used modern synthetic biology and synthesized this virus. And that's the product that we now call TNX-801. There's a complex evolutionary tree of horsepox because, on the one hand, it comes from the original progenitor horsepox, but we also believe that Jenner's vaccine was horsepox, and it's striking that an 1860 isolate from the United States after the Civil War was very similar, almost identical to the 1976 isolate that became the sequence for our vaccine. We tested the vaccine in non-human primates, and found that vaccinated animals were protected from a lethal challenge with mpox. Not only were the animals protected, but the vaccinated animals, shown in green and blue on the left two panels, had no lesions. So that means that they didn't have clinical disease and they weren't infectious from their skin. We also looked to see whether there was virus in their mouth by using oral swabs. And you can see again in the green and the blue panels, there were very few virus particles in the mouth. So the conclusion from the animal mpox challenge study is that a single dose of our TNX-801 horsepox vaccination was well tolerated and it protected against the lethal challenge with mpox. Not only did the animals live, but there was no clinical disease observed, and TNX-801 provided strong protection against shedding, viremia, and weight loss. TNX-801 is therefore a candidate vaccine for mpox and smallpox, but it's also a platform where we can express other antigens and make vaccines for other infectious diseases. So this is quite a surprising turn of events because, in fact, Jenner's vaccinia is the oldest vaccine technology, but now by recreating the sequence of live virus horsepox vaccine, we can put new antigen payloads into it. And this publication is an example of that, where we put the spike protein of SARS-CoV-2 into the horsepox vaccine platform, and we got good protection from COVID. Tonix has developed the capability to make new constructs for other infectious diseases and also to manufacture TNX-801, the smallpox and mpox version, potentially at scale. So in summary, we've brought back an extinct virus. This is the virus that was the basis, we believe, of Jenner's smallpox vaccine. And we think that this is important because Jenner searched far and wide for a new and better smallpox vaccine. So we get the benefit of all the work that Edward Jenner did to bring this vaccine to us. But in addition to that, we have 200 years of real-world evidence with Jenner's vaccine showing that it has good activity in protecting against smallpox or mpox. It's well tolerated in humans, and it doesn't pose an environmental risk because we already have the experience that with better hand washing and modern animal husbandry, horsepox disappeared on its own. Thank you very much for your attention. I look forward to providing you more updates soon as we continue to develop TNX-801 for mpox and smallpox.